Here we are on the couch with Steph Peterson. Steph, you're a med student in your final year?
Yes.
Currently where?
Currently in Hawke's Bay.
Yeah.
Yeah.
And what type of run are you doing?
I'm on my GP run at the moment.
Okay. Now, on day one here at the conference, you were on a panel discussion. What can we do better for our patients? And I understand you almost threw a hand grenade into the amongst the audience in some ways.
Completely unknowingly, yes.
Yes, yeah.
Yes, I did.
But a very positive reaction I've heard anyway.
Mostly, yeah.
Yeah. Okay. So what were the controversies that you were putting up with?
Well, the one that tend to get most people's backs up was actually the topic of antibiotics and how GPs are still prescribing them when potentially they shouldn't for viral illnesses. When we get told all through medical school that antibiotics are only for bacterial infections. Mm-hmm. But yeah, it was one of my smaller points, yes. But it got the biggest reaction, I think.
Right. Okay. So I mean, obviously evidence based. So how can you affect change on, speaking as a student and challenging people, obviously, so you may have got some people's backs up, but hopefully you've made a difference to that, because, are GPs aware they're prescribing inappropriately, do you think?
A lot are very aware of it.
So why are they doing it?
Well, not all GPs are, I think that's the thing, and I think it's the ones that aren't that got riled up by me saying that they shouldn't. Because I'm not sure how aware they are of their colleagues doing that, prescribing antibiotics.
That's quite wrong though, isn't it? I mean, isn't peer review supposed to pull these things up?
Yes, you would think it should. And I think, I don't know.
So I mean, arguably you're coming in as an idealistic student. Do you see people coming after or before you that this enthusiasm's been beaten out and they end up in the same rut as everyone else?
You mean the sort of younger?
That's right.
Younger GPs. Not so much. They're still very much antibiotics, right, for non-bacterial infections. Yeah. So no, it does tend to be the older generation.
Right. You can say that louder if you want. It's okay. Yeah. Whilst not trying to be controversial, it is reality, I think, and I think many people are aware of it. So what are the other things you're talking about is how we can do better for our patients?
So I talked a fair bit about drugs and overprescribing of pharmaceuticals,
yes.
In particular for depression or low mood, and polypharmacy in the elderly.
Yeah. So what are the reasons you're seeing for the polypharmacy?
I see GPs starting patients on medications because the guidelines tell them to, and not actually thinking about the patient in front of them and how the medications are actually going to affect them. And then I also see GPs not stopping drugs that have been started by, say, specialists in the hospitals.
Yes.
Because even if they're getting kind of side effects from them, they don't feel comfortable stopping them because they feel like the specialist must have started them for a good reason, which is sometimes true, but sometimes I think a little bit of discussion between the GPs and the specialists would be a good thing.
Mm-hmm. So longer appointments would be the answer to stop some of these things, because the business model, is that constraining some?
Yeah, I think the timing of our consultations is definitely something that we should be looking at changing. I think the option for a longer consultation be good, and also opportunity, like choices to have a short consultation.
Yes.
Because sometimes patients don't need long at all.
Yes. Yeah.
And that's how GPs catch up on time.
That's right. Yes, of course. So, so the frequent flyers, the COPDs, the diabetics, that having half-hour appointments for them would be a good thing?
Absolutely. Well, not necessary, probably, if they're seen all the time.
Right.
And if they're just there for a repeat prescription.
Yes. But like a review, though, perhaps, or an assessment at the beginning.
Oh, if they were their first consultation, they definitely wouldn't need longer than 15 minutes, I would say. Yeah.
So where do you see yourself ending up in the future? Have you got a specialty picked yet?
Not as such. I quite like obstetrics and gynecology.
Yes.
And I also do like general practice. So at the moment I'm sort of tossing up between those two.
So have your placement sorted out for next year?
The applications for the whole ACE scheme are actually due tomorrow. So I'm putting Hawke's Bay as my first choice.
Okay. Steph, thank you very much.
Cool, thank
Enjoy
you.
the rest of the conference.
Cheers.